Hello, my name is Meet Gundigara. I am from Gujarat, Bhavnagar. So I'm a software developer working in Amazon. We all know like about the Corona pandemic, right? In the second phase, like a lot of people were affected due to Corona in 2021. So I was also affected. So I didn't know like what medicine like doctor gave, but I think most of the doctor like in Corona gave Predmet 16 or some kind of steroids format medicine. So yeah, after Corona, I was affected by Corona in April 2020, and so I get to know like after in September, like September October time frame, like I was feeling little discomfort like while running, and also I used to play cricket every week, and so my running was affected like slightly. So then I went to 2 trips and I went to tracking as well, and so after that like I faced lot of discomfort, starting lot of discomfort. So first like initially I was feeling pain in knee, like so when I walked, when I start walk, and like I'm sometimes it becomes friction in the knee, like so initially like I went to some local doctors. So some of them were said that it was just muscle problems and it was nothing more, and one of the doctor went for knee MRI, and then like finally after 1 month like I went to one another doctor, and then he suggested for hip MRI, and then my AVN got diagnosed like and with the stage 3. And so initially like doctor told me that it was the initial symptoms like looking at that, and he suggested that medicine, like everyone knows like osteophos, like everyone doctor like preferred that medicine per week, like but yeah, like after 3 months like I went for another MRI, like I wanted to do another MRI because I mean I started physiotherapy in February itself, but like after 6 months like with the physiotherapy also like nothing much improvement in the result, like so I wanted to like spread an awareness like AVN is not like only about the pain and limping and all, like it's, I mean majorly it affects your range of motions, like movements, like for example you cannot I mean like slightly like I felt discomfort sitting behind the Activa. Then I in April like I wasn't able to drive even the Activa, like so it was a very discomfort like while driving the Activa. I can still drive the car like but yeah, I mean it's about it will mostly affect your range of motion. So you can diagnose also on your own like itself, like you can do the flexion activity, like so this kind of your leg should be moved to the knee to chest movement should be done properly, like you can check like that online, like search about abduction, rotation, like flexion, that movement will get affected like eventually, like and that's how you diagnose the AVN, like so it's very difficult to diagnose the AVN in terms of medical, but yeah, you can diagnose early, like and go for the treatment, like I would prefer. So how I came, I'll talk now how I came to Dr. KJ Reddy sir. So yeah, in these 3 months like I researched a lot, and like what can I go for alternate treatments, because I don't want to do hip replacement, because hip replacement will have their own problems, like you can never run on your hip, like when you do after you do the hip replacement, so I mean you can never regain your natural hip. I mean the natural hip you should try to preserve. So I searched a lot of treatments, like and then I came to know about the stem cells and bone grafting, and there are some these two options are like really good, like so. And then I researched about this sir, and like I found one very good video, like I mean that very, I mean the India's best orthopedics were doing research on the AVN, and the Dr. KJ Reddy sir was a moderator, so he has a very good knowledge about the AVN, like so. And then I came to Hyderabad, since my job is also there in Hyderabad, so I went to Hyderabad, and I took appointment online for using Apollo application, and then I came to Hyderabad, and then he suggested for the go the bilateral surgery in both hips, like one was in stage 3, one right was in a stage 2. So KJ Reddy sir suggested to go with the bone grafting in left, and with the stem cell in right after another 6 weeks. So yeah, I went for both the surgeries, and I'm feeling very good, like in terms of like stiffness. So most of the people will feel stiffness in the nights. Like I also used to feel the stiffness during the nights. Like I can't move from one side to another side, like not easily. Like and yeah, you'll not even get to sleep also. Like I mean, sometimes it happens that also. So yeah, that kind of comfort, like I am really feeling good. Like after doing both the surgery, it's my, I think my surgery happened on the 2nd September 2022, stem cell, and bone grafting 20 July 2022. So now I'm feeling very comfortable in some of the movements, and my movements also improved. Like so stiffness and all will reduce. Like so first, I mean the movement is, I mean the greatest improvement is stiffness. Like initially, like I can't even do my straight leg raise up, like and I felt a lot of discomfort. Like now I can like easily do my leg up, lift my leg up. Like so these kind of improvements are definitely there. Like even the rotation range improved. So flexion is still under progress, so it will improve. Like it will take some time. Like it's not there you do the surgery and just recovered on the spot. Like it takes some time. So it will take some one year after taking the regular medicine, osteoporosis and all. But yeah, overall it's a very good improvement after surgery, and I would really recommend Dr. KJ Reddy sir to go ahead and like do the surgery, like because in the young age, like it's not acceptable. Like when you are not doing your routine, like and affecting your routine, it's very I mean difficult to. So I mean I would suggest that to go for stem cell and bone grafting, like wherever whatever treatment it will fit to you. Like you should go there in the early stages and diagnose the AVN in early stages and go ahead with the treatment. And KJ Reddy sir have excellent experience, and he have done a lot of surgeries, I think, as far as I believe. So I mean excellent results to me like itself. So yeah, thank you so much.